United States, 18.8% of men smoke and 14.8% of women smoke. 16.7% of people aged 18 to 24 smoke, while 25% of people aged 25 to 44 smoke. 18% of people aged 45 to 64 smoke, and 8.5% of people aged 65 and above smoke. Every 19 males in the U.S. smoke, and every 15 females in the U.S. smoke.
Tobacco contains the addictive drug nicotine. For every 5 minutes the cigarette is lit, the user will get 10 puffs of nicotine. Nicotine is absorbed into the bloodstream and stimulates the adrenal glands to release epinephrine. Epinephrine stimulates the central nervous system and increases blood pressure, respiration, and heart rate.
Nicotine increases levels of the neurotransmitter dopamine, which affects brain pathways to control reward and pleasure. These consistent brain changes lead to addiction to tobacco. It is hard to quit tobacco because of withdrawal symptoms caused by addiction like irritability, sleep disturbances, and powerful cravings for tobacco.
Cigarette smoking is one of the major causes of all cancers. Nearly 9 out of 10 lung cancers are caused by smoking. Smokers today are much more likely to develop lung cancer than smokers were in 1964. Also, smoking causes lung diseases such as chronic bronchitis and emphysema.
Also increases the risk of heart disease and has been linked to leukemia, cataracts, and pneumonia. Most of these health consequences are not caused by the nicotine itself, but by the other chemicals that comprise tobacco. Tobacco smoke comprises of many chemicals, many of which are carcinogens. Carcinogens are substances capable of causing cancer in the living tissue.
16 million people suffer with a serious illness caused by smoking. For every person who dies from smoking, there are 30 people who suffer from a tobacco-related illness. There is also secondhand smoke. Secondhand smoke is the breathing in of the toxic chemicals that make up cigarettes because someone nearby is smoking.
Secondhand smoke has the same harmful chemicals as what the smoker inhales, so you will be absorbing the same chemicals as the smoker even though you don't smoke. Secondhand smoke causes the same diseases as mainstream smoke. About 88 million non-smoking Americans are exposed to secondhand smoke, including 54% of children, and about 41,000 non-smokers die from exposure to secondhand smoke.
Third-hand smoke is the residual nicotine that is left over on indoor surfaces. It is thought to mix with other common substances to create a toxic mix, which poses harmful to non-smokers who are exposed to it. Third-hand smoke clings on to hair, skin, clothes, etc., and mainly affects children.
Other effects of smoking. Smokers experience more complications of pregnancy, including miscarriage, problems with the placenta, and premature delivery. Smoking causes skin discoloration, wrinkles, and premature aging.
Smokers have trouble breathing because smoking damages the lungs. Less blood and oxygen flows to your muscles, which causes them to hurt more when you exercise or play sports. Tobacco ruins some of your taste buds, so you won't be able to taste your favorite foods as well.
Smoking also affects the environment too. In 2005, about 135 million pounds of cigarette butts were dumped into the U.S. environment. Cigarette butts are the most common waste found in cleanups in California highways. About 1.69 billion pounds of cigarette butts end up as waste every year. Cigarette butts make up about 34% of all waste captured in California.
Production of cigarettes is harmful to the environment because one tree is used for every 300 cigarettes made. Smoking is a direct threat to our forests, homes, and parks because discarded cigarette butts have been linked to large wildfires, resulting in the destruction of wildlife, vegetation, and property.
These effects lead to death because many of these instances are very harmful and detrimental to our health. This effect cannot be emphasized anymore. Tobacco use is the leading preventable cause of death in America, beating out HIV, illegal drug use, and alcohol use. Cigarette smoking caused 480,000 deaths a year in the U.S., which is 1 in every 5 deaths.
More than 10 times as many U.S. citizens have died prematurely from cigarette smoking than all who have died from the wars fought by the U.S. in all of its history. Cigarette smoking increases the risk of death in both men and women. On average, smokers die 13 to 14 years earlier than non-smokers.
Quitting tobacco use lowers your risk of tobacco-related diseases such as lung cancer and extends your lifetime compared to a smoker. Heart rate and blood pressure returns to normal instead of sped up by the nicotine.
Counseling and medication can be assigned to addicted smokers who desire to quit. Overall, quitting smoking benefits mentally, physically, economically, and environmentally to those around you.